their home, they take that with them. They also take their bedding. Yeah, and actually what we've done, just because of the way, normally whenever the kids move, we don't have new mattresses in. So we end up just moving the whole lot, and then as new mattresses come in, we just replace. But, you know, that's fine also. But yeah, all of their bedding would go up with them. Again, just so then it's theirs, yeah. We then, on day one, so most of the kids come in later in the day just because we're travelling from all over Swaziland. So they normally arrive, you know, even up till 9 o'clock at night if they've travelled far. They would then obviously just have a bath, get them clean, give them some food. We don't feed them much before they get here just because of the travelling. So, you know, we'll have a nice hot meal for them. And, you know, normally the first few nights we have tears, we have nightmares, you know, just all those sort of normal sorts of things. So there's always a staff member on a sort of a night shift that will come up, check on the kids. You know, obviously bedwetting is very high, particularly when they first come. And then the very next day they'll go to the clinic, and at the clinic they have a full medical. Now most of our children, we don't know their status, so all of them are automatically tested, okay, and then if they are HIV positive, we immediately start them on medication. We'll check for TB, and like Neil was talking about last night, ringworm, scabies, all of those things that are very easily treated. You know, we can just start treatment straight away. If they come in and they're already on medication, then obviously we've got a transfer letter and we just carry that on. And then once they've had their medical, we will go up to the office and they'll get clothes. So again, most of them just come with what they're wearing. Also on the bed, I should say that we'll do like a sort of welcome pack. So it's a bath towel, face towel, toothbrush, toothpaste, Vaseline, which is what they use on their skin to keep it nice and soft and moisturised, and pyjamas. So that's what they kind of start off with, and then the next day we'll go up, make sure that they've got changes of clothes, shoes. If we don't have there, then we obviously will just go and buy. But we're really blessed here, and we are actually regularly now getting donations. So it's, you know, we're managing much better for for things that are coming in. And what we've done a lot more in the last 2 years is when teams are coming in, or if people say like we want to send stuff, I will do a wish list. So I can check with the managers, look, what do we actually need right now, and be a little bit more specific. So, you know, because people want to give, and they actually want to give what's going to be used. So we can actually say, well, we really need towels, you know, we really need toothbrushes, or, you know, we can actually say what the big need is. Yeah, so after then the first day, then they would start at the bridge. So the first day is just kind of getting them organised, and then in that first week, me or one of the social workers will try and come and spend time with the kids. And again, we just go over making sure they do understand why they're here, and that they do understand this is a permanent, you know, a permanent thing. But what the opportunities sort of are, not in terms of like, oh, you're going to have a job later in life, but, you know, but just the fact that they will be able to go to school, and that, you know, they're safe here, and, you know, they're going to, they're going to be okay. And from that, we then just kind of assess their needs. Now, obviously, some of the kids come in highly traumatised, and it's very intense at first when they settle. Other kids come in, they love it, like from the word go, you know. And then 6 months down the line, bang, we hit a like a really big problem, and that's them dealing with what's happened. So obviously that really varies, and we just monitor it, and you can tell, you know, I can see with the child, like, okay, here we go. You can see the pattern, you can see things start. I'm working with a teenager at the moment who got gang raped, and she's been here for 8 months and has never ever mentioned anything. So I've seen it every week, and obviously I've known at some point something's going to come out, and it has just started. So we've had her like trying to run away, you know, sort of physical issues where she's kind of talking about being in pain, but I actually think that's just the memories of things rather than it being a medical thing. So obviously, you know, I will just up the amount of times I see her, you know, and she's actually mentioned what's happened. which that in itself is massive. So yeah, I mean, obviously we all work as a team here. We will spend time with the supervisors and they'll be like, look, there's problems here, you know, they've been fined, this is happening now. Behaviour issues, you know, just normal children's behaviour, you know, and then just trying to separate what's normal, what we expect, and then what is something else that's going on that we need to, you know, bring counselling in. Obviously trying to use different styles of counselling, so we'll use art, we'll use sport, you know, we'll use one-on-one talking, group stuff. We see a lot here where they'll come in very vulnerable, but they can actually kind of go into bullying others at some point. So then we'll deal bullying as a group, okay, and we'll get everyone that at that time is kind of being a bully, and we'll just address the topic, and you know, because that's normal, you know, they're just coming from a place where they've been bullied and suddenly they have the power and they take it the other way, and we just kind of bring it back. With the boys, we saw in the age group kind of 9 to 12 a lot of anger and a lot of aggression really coming out. And particularly with that age group, and particularly with the boys, you know, they don't want to talk, they don't want you to hug them, you know, and all of that. And so we really do use sport in a big way. So we started up a sort of football, a soccer thing, but more training, not so much playing a soccer game, but intense exercise, running it off, burning it off, and we only have guys involved with that. So we try and make it like a boys only thing, just having guys from the community that can just be dads around them, be a father figure. You know, the boys miss that male figure. Most of them don't know their dads, they've never known who it is, you know, the mums don't know who the dad is. So, you know, generally in the country it's a big problem, and so we're really trying to draw on the men of the community to also be part of this childcare, you know, because yeah, if not, they're not going to know how they need to be, and the guys know what it was like to be a teenage boy. You know, I don't know what it was like to be a teenage boy, you know, I can reach to the girls but I can't reach to the boys, so you know, we need the guys to be able to address the things that they understand. So that's kind of roughly roughly what goes on here. I'll let you just have a little wander through. We've got some bathrooms here, which is just like Jenny was showing us in Doozy, our maintenance team. It was an empty room, they've turned it into a bathroom. So feel free just to ask pictures, and then I'll hand over to Edward and she can just share a little bit about herself before we move on.